specifics. What we're looking for is $880 billion of reductions, but there's really no policy detail in any of it. And so, as Brian suggested, what we need to do is go back and look at, well, what were the prior proposals that have been out there? Because likely one of them is going to get taken off the shelf, or multiples of them. So you've got federal matching rates under pressure, especially with the increased rates that that states are receiving under the ACA to 90%. There's proposals to bring that down to 60%. Potential block grants of here's a block of money, spend it however you want. And then provider tax matches, and that one we're really going to look out for. Regardless of how you look at it, though, up to 20 million people could lose their Medicaid coverage. If $880 billion comes out over the next 10 years, that's the number that's being kicked around. And in the box to the right, I'll just end with what we identified was really a triple threat, specifically to hospitals. We work mostly with hospitals in this space, so our commentary tends to focus on them. But that triple threat is fewer patients eligible for coverage. Just we're going to need to change the way that we identify patients who are eligible. Reduction in what is covered. So for those of you who did manage to stay eligible for Medicaid, reduce the number of services that are potentially eligible. And then overall, lower reimbursement rates. It's just, okay, for those things that you in this waterfall, when you get to that last one, by the way, we're going to pay you less for every single one of these. So Brian has two jobs. He's our policy expert, but he's also a longtime consultant working with hospitals to maximize financial performance. So when I asked him to take off his policy expert hat, put on his consultant hat, and what advice he could give, what he hit very hard was make sure that you're maximizing every opportunity today and to get people onto Medicaid if they didn't walk into your facility with it. And then also stay abreast of the changes to make sure that you're continuing to maximize opportunities as we go, because regardless of what happens, something will change. There's